Hey everyone, welcome to Nomi Moves. Thanks for tuning in. I'm Nomi. Today we're going to be talking about supplements for healing. So recovery isn't just about what you're doing on the outside, but also what you are doing on the inside. One thing I noticed is that people don't really take or talk about the supplements that they're taking, at least not from what I saw from my research. So I wanted to put something together to talk about the supplements that I've been taking and how they help with specifically ACL injury. I will focus in on another time on my food, what I'm eating, which also helps with the supplements that I'm taking. But today we're just going to focus on the supplements. I want to put out there that before my injury, I was taking the Raw Nutrition Elite recovery bundle since March. This consisted of Liposamine, Creatine, NAD+, and Curcumin Resveratrol. Creatine supports muscle strength, ATP energy production, cognitive function. NAD promotes mitochondrial health, DNA repair, and cellular energy. Curcumin and Resveratrol are anti-inflammatory and antioxidant support. After my injury, I researched even more to find out what else I can take besides those three things, because clearly I needed more support than what I was getting, and I wanted to make sure it was specific to my injury. I found more supplements to give my knee a better chance at healing. The supplements I've added support soft tissue healing, collagen synthesis, and joint recovery. Full disclaimer, I do not like pills. I try to avoid them. I get very pill fatigued. Most people do. But I found that doing Liposamine liquid is a very good option. It has a higher absorption rate, so it works it works faster and works at a higher level. You get more of the supplement that you're taking due to the absorption levels. And sometimes, if there's no pill, I will take a gummy as well. And 2 of my supplements are actually gummies. So we're going to get right into it and talk about the 15 supplements that I'm taking, folks. So as I mentioned, I was taking creatine for obvious reasons because I do strength training with a lot of weightlifting, and I do pull and aerial. So I was taking that for that reason. So specifically, if you're wondering why I take it now, post-injury for my ACL, that is because it helps prevent muscle atrophy, improves rehab strength, enhances cellular energy for tissue repair. The NAD+, in terms of my ACL injury, will speeds tissue regeneration, and post-op will support recovery from surgical trauma. The Curcumin and Resveratrol reduces inflammation and oxidative stress, supports joint recovery, and provides a healing environment. Vitamin C is more than just an immune booster. In the case of having a ACL injury, it is essential for collagen synthesis and soft tissue healing. The women's multivitamin prevents deficiencies that could slow healing, supports soft tissue repair, and of course, immune health. So when taking collagen, there's different types of collagen. Most people take the common type, which is, I believe, a type 1 and type 3, which is for hair and your nails and your skin. However, when you have an injury like your ligament and soft tissue, you should be taking a hydrolyzed type 2. And what this does is improve joint and connective tissue health, provides amino acids for ligament, tendon, and cartilage repair. So my cartilage is a little frayed because of the injury that I sustained, and so Taking fish oil actually controls joint inflammation, supports cartilage preservation, and pain management. Irish sea moss replaces trace minerals for tissue healing and collagen formation. Liquid glucosamine and Chondroitin with MSM. So this supports joint health and flexibility, reduces inflammation, aids cartilage and ligament repair. It reduces stiffness and post-injury joint breakdown. Boron improves mineral metabolism for bone and joint health, reducing inflammation. So some of you might already know about vitamin B12 in terms of supports energy and red blood cell production. However, it also helps with nerve health by aiding nerve regeneration, as well as reducing fatigue during healing. People have noted that post-op, they do have nerve numbness in their knee. Some people, it only lasts a little while and goes away, and some people, it stays like that for a long time. By taking the vitamin B12 now, that will help post-op. Magnesium isn't just to get a good night's sleep. It supports muscle relaxation, which is why you get a good night's sleep. But it also helps with nerve function, reduces muscle tightness and cramping, and supports cellular recovery. So alpha lipoic acid, ALA, is good for nerve health. It protects nerves, reduces oxidative stress, supports long-term joint and soft tissue repair. And last but not least, vitamin D3 and K2. So in terms of the vitamin D3, it's all about bone health. Specifically, it's essential for bone remodeling. It helps with better healing at the ACL graft bone tunnels and meniscus root repair site, if you happen to be getting your meniscus repaired. Of course, it provides immune modulation by regulating inflammation, muscle function by reducing muscle weakness, and may improve neurovascular control. It also reduces injury risk. It's been shown that low D3 is linked to higher rates of ligament injuries and poor soft tissue healing. With K2, it directs calcium to the right places and supports bone quality. Together, they support tendon bone healing, promote stronger bone tunnel integration, and help build a healthier joint environment. And that's it for this video for Know Me Moves. I hope you guys found this informational, helpful. Like, comment, subscribe. Let me know what you think. I would love to hear from you. And yeah, until the next video. Bye.